Hi, my name's Stacy Lacey and I'm the inventor of the Heavensent Sleeve. Today I'm going to show you how to use this for headaches and neck pain. So the device we have here, we're going to place that underneath at the base of the skull where all the muscles attach right here, not on the bone itself, but just below that. You have a ton of different muscles. Many times when we have headaches, it's because the tension in these muscles is so great. So what we're going to do is place this underneath. So go ahead and lift up for me. And we've got that right there. She's going to hold on to this. Good. She's going to hold on to this. Good. Now, sometimes that will slide down into this space right here. So we may have to use a little bit of a towel roll to kind of hold that in place so that her arms can relax. So we're going to do that. Good. Many times we'll have one side that is more tight and bound up than the other. So she's just going to stay here 2, 3, 4, 5 minutes, sometimes even up to 10 minutes because there's so many muscles that attach there. So once she feels like that feels even on either side, then if she has one side that's more tender than the other, so let's just say it's her right side, she's going to just turn her head slightly. And that's just a little bit different muscle. We're getting right back here behind the ear. You can see the mastoid process there. We have a lot of muscles that attach there and kind of fan out and go to the front of the neck and down into the side of the neck. So the goal of this is to help release the muscle tension so that it quits pulling on that occipital bone in the skull, and it's going to allow her to have more pain-free access to this skull. So the next place that we're going to do that is going to be right at the back of her head. You can feel there's a little valley right at the base of the skull that comes up. There's a little knot right there. And we're going to go on either side of that bump. Okay, that's called the occipital protuberance. We're going to be right there. And she's just going to hold that, making sure that her nose is pointing straight up to the ceiling. And what that's going to do is stop this cranium from moving. Normal movement of the cranium is in and out like this. According to John Epledger, he's the one that has made craniosacral therapy more mainstream. So these parietal bones are moving in and out. She's got the sphenoid underneath, and the spinobasilar joint is going to be moving like this. So what this does, stops the cranium from moving, allows her to go into a still point. And when she takes this out from underneath her, after she feels like she's been there for a long enough amount of time, then we'll just take that out, and then she'll have a nice, big, hopefully symmetrical movement in the cranium. Many times we have headaches if we have very, very slight rotations or torsions within these cranial bones. So this is just another way. The great thing about this tool is that you can use it anywhere on the body. Today we're showing you right here how to use it for headaches, any type of migraine, even sometimes symptoms such as hay fever. That can even be helpful with that. So she's going to stay here 2, 3, 4, 5, 10 minutes, whatever she feels like is helpful, and then she can be finished. So thank you so much. Thanks for listening. God bless and healing to you.